Here with One TDC, and we have a really important show for you folks today. A very important topic, as you can see on the screen, feline stomatitis. We're going to have a Q&A session with Dr. James Anthony. He's a veterinary dentist for many years, over 30 years of experience as a dentist. He's one of the pioneers. And full disclosure, Dr. Anthony is actually our chief medical officer. If you know Dr. Anthony, you'll know that he's very big on research. As a matter of fact, he's done the research on One TDC and always does a lot of clinical review and experience. Specifically in the topic of stomatitis, he has seen thousands of cats over the years. So we know there's many of you in many Facebook groups and so forth that have a lot of questions for your cats, a lot of great, cat parents that are out there asking a lot of questions. So we really thought this segment would help you answer some of those really burning questions that you may have. And we really thank you for those that have registered ahead of time and submitted the questions. So we have those questions that are there for you that will be on the screen as I bring Dr. Anthony. We're also live, so if you have any questions that come up, definitely go into the chat section and ask it, and we'll monitor for that as well. In addition, many of you are going to want to get the transcripts of this segment. This will be something very easy for you to have access to, and it's free, of course. All you have to do in the chat section, just put the word stomatitis, obviously pretty appropriate for this segment, and we'll give you access to that. Matter of fact, we also are doing some giveaways of the One TDC to help some of you folks as well. So without any further ado, I'm going to bring Dr. James Anthony. Give me a quick second here. Hello, Dr. Anthony. Thank you for joining us today.
You're very welcome, Olivier. Thanks for inviting me.
Well, we're excited to have you. As you know, I know this is a topic that's very dear to your heart. As I mentioned, you have seen many cats with this very devastating disease. And we're excited to have you and answer the questions from the audience. So if you've just joined us, this is Dr. Anthony. He's a veterinary dentist, and he's going to be answering questions for you in relation to stomatitis. With the questions that have been submitted, and if you have more, please don't hesitate to put it and post it, and we'll do our very best to catch those. Dr. Anthony, thank you.
Pleasure.
Okay, so let's get right into the topic in understanding what is stomatitis. So, people have different levels of understanding and different level of research. So, Dr. Anthony, what exactly is stomatitis, feline stomatitis?
Well, that's a very good question. The biggest problem is that this name has been given many names, like lymphocytic, plasmacytic stomatitis, feline chronic gingivitis stomatitis syndrome. The list goes on and on. There's probably about 16 different names given to this complex. And whenever that happens, basically what that really means to, what should mean to you and me, is we don't know exactly what's going on. Not exactly. We have lots of ideas, we have lots of speculation, and we are getting better and better treatments all the time. However, we still don't understand the full mechanism, or what we call the pathophysiology of this disease syndrome. Now, the other thing is, stomatitis is a catch-all phrase for a whole different bunch of stomatitis syndromes. So sometimes we'll have caudal stomatitis, which means only disease in the back of the mouth, or full oral stomatitis, which is a much more advanced state, or just cranial stomatitis, usually periodontal disease, and not stomatitis at all. And then finally, also, we can have juvenile stomatitis as well, which is only in younger animals. So there could be a number of different names to this. Second of all, what do we see? First of all, what we see is basically severe redness, usually in the whole oral cavity. This redness is also associated with ulcers and fissures, which are really painful for these cats. This is what is really debilitating for them. If it was just a redness, that's bad enough. It's a little bit sore, but not that much. But the ulcers and the fissures are really painful. That's where you get all that, the facial features of them being in pain, the drooling, the not wanting to be touched in the mouth because it's so painful. Simple as that. Each time they open their mouth, it hurts. So as a result, it's a very debilitating condition that really these animals do suffer an awful lot with this. Now, what causes it? Well, we don't exactly know, but we know that there's many, many factors associated with it. We know that viruses are a major component. Calici virus being one of the main ones. That's a respiratory virus. Feline immunodeficiency virus, feline leukemia virus, a number of different types of bacteria, such as gram-negative anaerobic bacteria, which means that they require no oxygen to be there, and actually they're very destructive, and they're definitely there. And a lot of times, feline herpes virus is another big component of this. So there can be a number of different factors. One of the major factors is stress. So if the animal is stressed, they will be able to basically get exacerbated pathology or disease in their mouth because of the stress. Because the stress weakens or makes the immune system not as efficient. And as a result, all these inflammatory components can basically act up and cause some major destruction in the mouth. Now, I could get into much more detail than this and tell about complement factors and all these things about inflammation, because inflammation has a lot to do with this, and usually a lot of it's the body's inflammation that is spurred on or turned on by oral bacteria or plaque. Plaque is basically mainly 85 or 87% bacteria in it, and it's the gram-negative bacteria that really turns them on, but also the viruses also turn on the inflammatory component as well.
Excellent.
That's a lot. That's
well, I know you've lectured around the world around the subject, that you could probably go on from a science standpoint. Folks, if you've just joined us, we are live with Dr. James Anthony. He's a veterinary dentist. He is graciously doing a Q&A for us today in relation to feline stomatitis precisely. If you have questions, we have a series of questions for those that have already signed up ahead of the show, and thank you for that. But if you have anything else that comes to mind, please don't hesitate to put it into the chat section, and we'll do our best to capture it for you. So obviously, one of the key questions that people have asked Dr. Anthony is, in your clinical reviews, how do you treat stomatitis in your practice? How have you managed? And I know it's a very complex disease, but what are some of the protocols that you can share that could help some of our audiences of, making sure they're on track, or perhaps things they could be asking for from their veterinarians?
Well, the first and foremost thing, Olivier, is to get a proper diagnosis. And what that means is, before we would even consider anesthetizing this patient, we would want to do a full blood workup, because sometimes viral titers as well, and to basically see what is there. First of all, we want to see, is it safe to give this animal an anesthetic to clean up the mouth, that type of thing. So we want to check the liver and kidney function out. Excuse me. Second of all, we want to see if they are basically having Calici virus or herpes virus or anything else that are complicating factors that will usually tell us a lot more about the intensity of the disease, or what it could be as intensive as. And then what I do after we find out that it's safe to give an anesthetic, I give an anesthetic, and I will do biopsies. So I'll take little chunks of tissue from the mouth. A lot of times, these little areas of progressive tissue can be tumors instead of stomatitis. So we want to make sure that we're not ignoring anything here, because obviously if there's a tumor, that's a different story and requires a totally different treatment plan than stomatitis. Excuse me. So once we have that biopsy back, and what we do is full mouth x-rays and see if there's significant periodontal disease. If there's significant periodontal disease, we will treat the periodontal disease. So in other words, if the teeth are really advanced as far as periodontally disease, we will more than likely extract them. However, to go ahead and say, oh, it has stomatitis, we need full mouth extractions, that's usually not the situation that's necessary. You want to make sure that basically two things. Before you even go ahead with any treatment, you need to see what the commitment is of the owner. So in other words, are they going to do the recommendations you give? Can they do the recommendations you give? And also the cost factor as well, because unfortunately some of these procedures are not cheap, and it does add up. Bottom line with treatment with this disease syndrome is there's no cure. I repeat, no cure. However, we can control it and improve the quality of life to these patients tremendously. So it's not a matter of basically curing the situation, it's a matter of basically getting it into a steady state as best we can, and then keeping it that way with home care with owners. And then there might be the odd flare up, and as a result, there's things that we can do about that. Now, what do I normally do? A lot of times when I'm basically doing the biopsies and whatnot, I will put these animals on home care products to actually just keep everything from getting worse. What I will do is put pain medication on, something like, for example, gabapentin. There's many other basically pain medications as well out there. I will then also give a chlorhexidine rinse and just give a small amount twice a day. I will also use a product, a zinc ascorbic acid product, that actually basically decreases plaque and increases collagen formation in the gums. Collagen is the first tissue to be destroyed in gum disease. Helps heal the mouth. And that's twice a day as well. 1 TDC, because of its anti-inflammatory effects. Basically, it significantly reduces inflammation in the oral cavity that I have seen in practice and in research. And I give that twice a day. Now, so in other words, I usually double the dose of it. Also, I'll give some antibiotics. I use a liquid, and actually all these products are liquids, because a lot of them, basically, they're pills. The animal's in so much pain that they won't even want you to touch their mouth, never mind open it and put a pill in. So these are things that will actually quickly bring it and suppress the inflammation. Now, with all these products, if we give them a month, usually I would say well into the 90% range, the fissures and the ulcers are gone.
Wow, that's huge.
As a result, the quality of life for this patient has vastly improved. However, there'll still be redness in the mouth. And if there'll be the odd flare up because of stress and that type of thing. And in some cases, we do have to remove basically all the teeth. To me, that's more of a last resort. However, basically removing all the teeth, basically they can still have flare-ups because plaque can accumulate on the roof of the mouth, on the tongue. As we know, and your dentist will tell you, brush the teeth, brush the roof of your mouth as well. And if the animal's stressed, you can get a flare-up. So, like I said, control, but we have to get the diagnosis first. Because if there's a tumor or if it's just periodontal disease, clean up the mouth and to basically take out any teeth that are, let's say, losers, quote unquote, and basically home care afterwards. Very simple. However, stomatitis, basically it's the body's immune system is just not quite as strong or overreacts, and as a result is a major factor in this disease process.
Dr. Anthony, thank you for this in-depth answer into how you treat stomatitis. And if you just joined in, folks, we're with Dr. James Anthony. He's a veterinary boarded dentist for many, many years. And if you've missed part of that, don't worry, there will be a transcript of all of this. Just go into the chat area and just put the word stomatitis and you'll get access to that. We have some questions that are coming in, so I'm going to flush from both of them, Dr. Anthony, just so you know. And I'll put it here so you can actually see it. We have a question from Jessica. My cat has bad breath. She's 3 years old. The veterinarian has said it looked like it may be the start of stomatitis. Any recommendation and how can you help? And this is such a common experience that cat owners get. And the one thing I will say, because Dr. Anthony will probably not want to say this, not all veterinarians are created equal when it comes to oral health knowledge. So not everybody has access to a veterinary dentist, unfortunately, and there's a cost associated with it. So this is a perfect question that a lot of cat parents face. Bad breath, it could be leading to stomatitis. Can you explain what's going on here and what should they be thinking through? Thanks for the question, Jessica.
That's a good question. The big thing here is just because it has bad breath doesn't mean it will have stomatitis. So that's the first thing.
Yes.
If there's sneezing and a ruddy nose, ruddy eyes, it could develop into stomatitis. And of course, there's always a chance it could develop into stomatitis at a later date. However, when you have bad breath, basically that means that there's something wrong in the oral cavity. Mm-hmm. It means that either you're not doing any home care in the mouth or there is a disease process going on. So the first thing is to look in the mouth, which her veterinarian did, and saw maybe a mild periodontal disease or something like that. And then as a result, some home care should be done. Now that home care could be a dental diet, just putting the animal on a dental diet, simple as that. Could be adding, basically brushing the teeth. I mean, it's not that easy to brush a cat's teeth, but it can be done. But it's a very slow approach to it and a progressive one. So it's not something you're going to achieve overnight.
Right.
There's lots of other things that are easier, like water additives, those types of things that will decrease the amount of plaque in the mouth. Now, after this, so you've done some home care for a month or so, and that breath has not improved, something else is going on, and that needs another visit to your veterinarian.
Excellent. Thank you for that, Dr. Anthony. Let me go into a question that came in ahead. And this is, unfortunately, a common question for cats with persistent stomatitis, even after a full mouth extraction. What, aside from steroids and pain management, would you suggest for treatment? So if you could go into that, because maybe if you have some numbers as well, a lot of pet owners, cat owners get to the point where, the full mouth extraction is a solution that's been identified. And some say they've done that, and there's still a problem. So if you could shed some reality around that, I think that'd be very, very helpful for our audience.
Sure. Well, with full mouth extraction, you mean all the teeth have been extracted.
Canines and all, yep.
The biggest thing there is to make sure that all the roots are out as well.
So how do we make sure of that? Sorry.
Okay. Then basically after that, we still will have plaque accumulating in the roof and on the tongue of this animal. And as a result, we can get flare-ups once in a while. Some animals will just have automatic flare-ups because basically there's plaque there. And as a result is a constant battle. Now, as far as treatment goes, as far as steroids are concerned, I think the first year in practice, I used steroids, and I haven't used it since.
Really?
I don't use steroids at all because there's too many side effects. A lot of people will say, oh, there's the stomatitis shot. Well, there's no such thing as a stomatitis shot. This is a monthly injection of a long-acting steroid, and actually that actually makes the disease even worse down the road.
Really?
It makes it more what we call refractory, so it's much more difficult to treat. So steroids, I try to lean away from them. Now, painkillers, yes, absolutely, because these animals are in pain. I've already mentioned some products that I talked about earlier that work very, very well with home care. And as a result, with these full mouth extraction, these animals should be on that on a daily basis. Just once a day. It only takes about 30 seconds to do everything. So it's not a major undertaking. And these products are not that expensive. If you can avoid surgery, that's expensive. You know, where if you're not, if you're doing surgery, yes, it'll be costly, but home care, these products are very, very inexpensive. The two gels I mentioned, basically one bottle will do almost a year. TDC, basically, you know, it's 25 cents a day almost. So it's not something very expensive. I mean, your Starbucks coffee is going to be a lot more than that and be harder to get too.
That's very true. Actually, on that note, we have a question. You just mentioned the 1-TDC, and a lot of the audience are already using it for their cats. But Jay Ashley asks, and this is something, you know, beyond 1-TDC, any home care. If you have an aggressive cat who doesn't allow you to apply, as an example, 1-TDC to the gums, can you just put on the food, or do you have any other solutions that you've seen clinically to still get benefits for those cats?
Well, one, you could put it on the food. That's one. Yes, that would be an easy one, but there will be a little bit of a dilution effect there. And basically, it can get onto the feeding dish, and as a result, the animal may not get the full amount of the product. Basically, you could try to just put it on the lip, but if the animal still doesn't like that, which a lot of them don't, for the 1-TDC, what I do a lot, especially with these cases that have the fissures and ulcers, for the first month, I'll ask it to put them in the ear, what we call the peanut of the ear, which is just out the inside of it. I'll just squeeze it on, just swirl it around a little bit, leave it on for about 10 minutes, come back with a Kleenex and just gently clean it out, and do that once or twice a day.
Excellent.
And that 10 minutes, basically 95% of the active ingredients are absorbed through what we call transmucosally, through the membranes of the ear, and as a result is distributed already through the body.
Excellent. Good. That's a great way of doing it to make it easier for the cat owners. Let me go to one of the questions that was sent to us ahead of time, and that's a common one as well, is what food should we avoid giving to our cats that have, maybe severe gingivitis or stomatitis?
Well, you have to remember these animals are in pain because of the ulcers and fissures. So if you're giving hard food, well, maybe you should water it down. Water it down where it and just maybe puree it a little bit, so it's more like a soup. And as a result, basically, they will just lick it up and will be less painful. And as a result, you're trying to just make it as simple as possible for them to eat. We don't want anything hard or anything really chewy or that. Something that is soft. So it could be even adding some soft food would be another option. But I prefer to use the regular diet, just pureed to basically a thick soup, so they can lick it up. Because by doing that, you don't change the diet, and you're not going to get the diarrhea associated with the change in diet.
Great point. Great point. Thank you for the answer on this one. We have another point from Casey that let me just put, this is a long one, but I think it's worth, because I'm sure some people have gone through this. So Casey's asking, my feline, so it's got obviously stomatitis and I think FIV as well, if I read this correctly, has had full mouth extraction and root extraction. So hopefully they've done the post x-rays as well. And multiple flare-ups since then. Steroids with antibiotics giving relief, but the vet says that no more steroids because of the potential side effects, which is what you were just talking about, that you don't even use it.
Right.
So the question was that he's had seen by a vet dentist, but the clinic has done what they can. Is there anything else that you could help Casey with that they could do? So the steroids are out, still get some flare-ups. I would assume if a vet dentist has seen the cat, that hopefully there's no roots that are left, and you still have some flare-ups. And you talked about the film on the roof of the mouth and the tongue that could still create some reaction. What would be your advice for Casey?
The first thing, if all the roots are out, which the only way you know is by taking x-rays.
Right.
So if the roots are out, basically, then it's a matter of medical management. And painkillers are very important. So that's one thing that I would do, right, because that way you can get the other home care in to get plaque control. So what we want to do is get some plaque control in the mouth. Now, they mentioned that the animal was on antibiotics. The big thing is, what type of antibiotic? Is it one that gets anaerobic bacteria or one that gets aerobic bacteria?
Got it.
Because, it's like saying, I have a car, but it's not going as fast as my previous Ferrari, but it's a Volkswagen, Well, they're different types of cars, just like there's different types of antibiotics. So as a result, basically, you want to basically remember that this is an ongoing home care program. You're not going to get cure, you're going to get control. And it's a maintenance program that is the key. So as I mentioned earlier, the TDC, the zinc ascorbic acid, the chlorhexidine rinse. Some people will put them on low-dose doxycycline, which is an antibiotic for their immunostimulant effects to actually help the immune system. And there's many others. Some people will use lysine, again, to help control the immune system. And there's many other products out there. The ones that have worked well with me, I've already mentioned.
Excellent. And just one point of clarification also from Casey is the cat does have leukemia positive as well. So it would be any difference in what you've shared specifically in helping Casey out? Or
all what that means is that the immune system is going to be a bit weakened, and as a result, stress is going to be more important to keep under control. What is stress on a cat? A lot of times that's just moving the chair to the other position. So it can be as simple as that.
Yep.
But try your best to try to reduce it.
Excellent. Thank you for that. And Casey, thank you for the question. We have another question that was sent to us ahead of time. So this person has rescued 7 cats. One has stomatitis and calcivirus. And they're pretty sure that the others may get the virus as well because it's highly contagious. So any recommendations that you would, to be proactive from a contagion and maybe any treatment or any preventative solutions that you might suggest?
Well, obviously the one that has stomatitis and has the Calici virus, it already has it. The other ones, if they haven't been exposed to that cat, should be vaccinated. And vaccination will really help those animals.
Excellent.
To help prevent this from having another contributing factor to spur on this stomatitis. However, if they don't get proper immunization and also proper home care, if they don't get oral home care, they could develop stomatitis down the road. But the big thing in that situation, I would make sure that those other cats are vaccinated.
Excellent. Thank you for that. Let me just see. We had another one that came in from Marcy, and this is someone that was a recurring question as well. And this is a really good question. Is there any risk or reaction side effects from one TDC? My cat is on pregabalin and also reacting to Zartec, I assume for allergies and Serenia injection. So the first thing is any side effects that you have seen with one TDC specifically, and then you can see the rest of the question as well.
The only side effect I've ever seen with one TDC is that the animals get better. So, so that's good. So it is a very inert product. It is a product that usually is extremely flavorful. So the animals love it. However, there is the odd animal that does not like it, that's where putting it in the ear or in the groin will be basically easier to administer. So as far as is there complications with other products? Not other products, but maybe one cautionary note that I would say is if the animal is on, let's say, a fatty acid supplement, that they reduce the fatty acid supplement to a lower degree, just because fatty acids can actually cause some blood dyscrasias. TDC's major component is fatty acids that have been modified with its process. So the chances of it happening is slim to none. However, as a precautionary note, I'd rather be on the safe side than take the risk.
Excellent. Thank you, Marcy, for the question. And let's go into another question that was provided to us ahead of time as well. How can I prevent the mild gingivitis to develop into stomatitis? And Dr. Anthony, expanding on these questions, is it because my cat has gingivitis that it will automatically lead to stomatitis, or how does that work?
If it's gingivitis, it's usually periodontal disease in origin. And this home care is all that's required.
Got it.
However, once we get the back of the mouth, what we call the caudal aspect of the mouth, inflamed and ulcerated, that is stomatitis. And gingivitis could develop into stomatitis, but most times just periodontal disease.
Got it.
It's relatively easy to get under control versus stomatitis. So prevention of mild gingivitis is home care. And there's over 2,000 different products in the market today for plaque control in North America. Most of them are lousy. They don't work. But there's a lot that do. And that's where asking your veterinarian about these products is one thing. Looking at the Veterinary Oral Health Council's recommendations and seeing the seal of approval for plaque control will be helpful. Like TDC won't be on there because it basically doesn't do anything for plaque. It's for inflammation.
Yeah, to promote healthy inflammatory response. So specifically, Dr. Anthony here is mentioning about VOHC. So for the tartar and the plaque specifically, that they can certify, and they can't certify products for gum health because it's not a tartar and plaque solution. If you've just joined us, folks, we are with Dr. James Anthony. He is a boarded veterinary dentist for many years, and he's answering some Q&As for us in relation to feline stomatitis. And thank you for doing that, Dr. Anthony. We're very much appreciating that. We had a question actually come from Romer out in the Philippines. Romer, thanks for the question. Is there any association with periodontal disease and kidney disease? This is a very common question. What can you tell us about that?
Well, there's definitely an association. There is not what we call a cause and effect. So in other words, if you have periodontal disease, is that going to cause kidney disease? The answer is no.
Okay.
However, if you have periodontal disease and other factors together can result in kidney disease. So it's not just periodontal disease, it's other factors as well. I mean, the World Health Organization has come out even stating that in humans as well.
Wow.
And that there's many other diseases of age, such as dementia, diabetes, the list goes on, that are associated with periodontal disease. So there's a number of different disease syndromes for aged animals that are associated with periodontal disease. That's why we stress the home care so much, because if you do good home care, your animal's going to live longer and, more importantly, a happier, more comfortable life.
So it sounds like a healthy mouth, a healthy body is not just a statement. It's validated based on what you're saying.
It's reality.
No, thank you for that. The next question we have is, and you talked about this a little bit, my vet recommended a stomatitis shot per month for my stomatitis baby. Now I found out that she has an enlarged heart because of the shots. what can I do different? So I think probably what I'd want to help our audience here is, A, is there such a shot, and you kind of tackled this earlier, that can help with stomatitis? And B, whatever those shots could be, could that have an impact on the heart?
Well, the first thing is there is no such thing as a quote unquote a stomatitis shot. There's no magic bullet.
Okay.
Simple as that. Now, what I speculate that this person may have been doing is giving a long-acting injection of a steroid.
Okay.
And I mentioned before, that will result in more of a refractory condition. So one that is much harder to treat down the road. And it can have side effects. It's not common to have an enlarged heart because of that. So I don't think that a steroid injection itself will cause an enlarged heart. It would be very unlikely. There could be other reasons for that.
Okay, that's good to know. Not to alarm anybody else of concern. We have another question. I think this is a really important one as well from Heather. Thank you, Heather, for the question. So should full mouth extraction even be considered when the cat has FIV? My understanding is that it is not very effective with cats that have FIV.
I wouldn't agree with that statement. First of all, definitely I would take out the teeth that are bad.
Okay.
And if the owners are not going to do good home care, then I'd probably take out all the premolars and molars, leaving the canines and incisors if they are healthy.
Okay.
If they're healthy, I still would use home care, the products I mentioned earlier in this program. And I would say even with FIV, I get a lot of success with that protocol.
Okay.
So it's not a matter of full mouth extractions not working. It's the aftercare, the long-term care, and reducing stress, good nutrition. All those things are important.
Excellent. And obviously, Heather, as you know, Dr. Anthony can't see your cat, doesn't have a full medical history of your cat. So, yield to your veterinarian that would see all of that with the blood work, like he talked about earlier, the whole protocol leading to even considering the full mouth extraction. Thank you for that, Dr. Anthony. Let's go into another question that was pre-sent to us, and this is a great one as well. Can Bartonella cause gingivitis stomatitis to cats?
In certain areas of the world, I would say yes. In my experience, I have yet to even see it. Now, Bartonella is common in certain areas of North America, and I believe that it does have some contributing situations for gingivitis and possibly stomatitis as well. I have not seen that. So I've tested for it, but I have not seen that. So I haven't had really experience with that, bacteria, because basically I've never seen it even when testing.
Okay, that's good to know. So aware of what's out there from your clinical experience, the answer is no.
It's regional.
Right. Understood. We have a question here, and I'll read it because it's a long one from Dina. And thank you. Hopefully I'm saying that right, Dina. Thank you for the question. My vet never specifically said my cat has stomatitis, but the cat get horrible ulcers about once a month. His teeth have been inspected a couple of times, and there's no plaque or periodontal disease. The ulcers are so bad, and you can't see that, but I see it here, are so bad that it's been cauterized twice. The vet currently treats with steroids shot once a month. Just looking for other options to treat. Does that sound like stomatitis?
Okay. Well, first of all, it may not be stomatitis induced. It could be that there's an excess amount of tissue that has been produced from a chronic irritation from constant trauma of the teeth, and basically trauma causing of the soft tissue may have resulted in the ulcers. So it may not have been from stomatitis. However, with stomatitis, if they've been getting a regular injection of long-acting steroid, as I mentioned earlier, it can redevelop into a much more difficult case to treat. The big thing here is, has the vet done any x-rays to see if there's really periodontal disease? Because sometimes, not sometimes, a lot of times, we'll look at an animal's mouth and it looks not bad. But if we take the x-rays, we see no bone support around the teeth. And it's all from periodontal disease. So it warrants some further investigation. I would definitely recommend full mouth x-rays on this animal. And then if everything looks good, I would try to do some home care, as I mentioned previously.
Excellent. Thank you for that. Thank you, Dana, for the question as well. So if you just joined us, we are with Dr. James Anthony. He's a veterinary board dentist for many years, and he's answering questions for us around feline stomatitis. And we have another one that came before, and I think we kind of covered that already. Could stomatitis be stress-related and not become chronic? Interesting question. My cat has had a complete turnaround in 24 hours after taking Zartec. We talked about Zartec earlier, twice, and does not have any, in basically, cat's doing dramatically better, and the person's concern is that, is this really for real, that, or is she in for a big shock that it is more than stress, basically?
Well, the stress is a major component, as I mentioned before. Zyrtec is basically an antihistamine, basically, and it can reduce some signs, but I do not use that product because I just find that there's other products that are far more effective, which I've already talked about. Okay. So yes, stress is if you control the stress, you will have a much better chance of decreasing the severity of this condition. If it's the big thing that kind of irritates me is, why is it occurring once a month? Oh, and is it occurring the same time of the month? Is there something that's going on in the household that there's a big social gathering or something, which hopefully with the pandemic around that's not happening. But is there some stress happening at that time period? So that owner needs to look at that situation and address those things. But if it's basically happening once a month, I would start doing a little bit more home care and see if we can get it even off the Zyrtec. Because I prefer not to have any drugs at all possible.
Understood. Thank you for that, Dr. Anthony. We have a simple question actually from J.H. Lee, and obviously there's protocols and there's regionally different protocols around this, but J.H. Lee was told that a dentist told him not to use vaccinations anymore when the cat's got stomatitis, and things as rabies shots can cause issues too. So I want to be sensitive here. There's there's laws, and of course there's sometimes, I will tell you, J.H. Lee, there's even different perspective from one vet dentist to the other. So I don't know what your thought is on this in relation to vaccination, Dr. Anthony.
Well, if the animal's immune system is compromised and is not as competent as it should be, you shouldn't be vaccinating an incompetent immune system's animal that already has a disease. So that goes without saying, and any veterinarian will say that. So in other words, if the animal is sickly or whatnot, is busy fighting off an infection, the vaccine is not going to be very effective. And as a result, wait till the animal's healthier. They can still have the disease, such as stomatitis, but if it's under control, it means that their immune system is controlling it. And they should be okay to have that vaccine. However, if it's not under control, I can see where the veterinarian is coming from.
Understood.
I mean, I'm not an immunologist, so I can't say exactly the right answer to that question.
Well, we appreciate that you're staying in your lane, but your lane is large enough for us that we're getting a lot of valuable information. So thank you.
I hope so.
Indeed it is. Ashley, thank you for the question. Another question that was asked before, and I think you've covered some of that as well. Best treatment options to prevent other cats in my rescue from catching stomatitis calcivirus?
Well, definitely vaccination is really important, but also home care. And if you do the home care and vaccination, good nutrition, good health, reduce stress, that's the best that any pet custodian can do, because you're doing the best for the animal then.
Excellent. And for those who have just joined, and you'll get access to the transcript, just go into the chat area and just put the word stomatitis if you haven't done that yet. And some of the protocols that Dr. Anthony talked about, it's all there, and you'll get access to that as well. Another question for you, Dr. Anthony, was in relation to another product. Is it risky to give Atopica to a cat with stomatitis? What's your experience with that?
Well, as I mentioned before, I prefer not to give any drugs if at all possible. However, in really refractory cases, which are really difficult to treat, Atopica is a very good product to use. It is a safe product, but you need to monitor the animal. So in other words, you need to do some blood tests and repetitive blood tests as well, okay? Atopica can work very effectively, and it basically modifies the immune system and is a very effective product with stomatitis in refractory cases, but it needs to be monitored. That's the key for long-term success here. So is it risky? There's always a risk with any drug. The risk is minimal with this drug. However, like I said, if you don't have to use it, I'd rather not.
Excellent. Thank you for that.
Now, let me just add one more thing. There are some drugs that we have used for this situation that really we don't recommend anymore because the dangers are that bad, such as gold salts. Gold salts are basically really damaging to the kidneys. Another one is Imuran, which is basically a very drug that will cause a lot of problems with livers. So those two and others we don't use. So it is a very good question about what type of drugs are safe. And really, your veterinarian is really the best person to ask if that drug is safe or not.
Excellent. That's good insights for us. Thank you. The next question we have for you, Dr. Anthony, is 7-year-old cat is getting full mouth extraction, and it's a lower cost charitable surgery location, but they don't do x-rays. Do they need their vet to do that? So if you can talk again, you've touched upon that earlier, but to really get a clear vision of what people should expect in relation to x-rays, and is it essential?
Well, x-rays beforehand, absolutely. And basically, I would even recommend x-rays afterwards, because you want to make sure that you get all the root tips out. It's easy to break teeth. Every veterinarian breaks teeth. Even I do. And as a result, you have to go in and get them out. If they're left in, it's going to cause and result in some form of irritation, and basically we will still have the stomatitis. And eventually we'll have to go in again and get those root tips out. So for me, I'd rather do a real good job one time, and that's it. Because I don't want to put anybody's pet through another procedure. One procedure, that's what I want to do.
Excellent.
Do the best job I can.
Good to know. So you have your answer: pre and post x-rays for the well-being of your cat and really diagnosing it effectively.
And also the x-rays will tell you if there's a lot of inflammation to the bone as well. Because a lot of times that bone needs to be taken away as well if there's a lot of inflammation to that bone. So basically the x-rays will tell the individual, tell the veterinarian what they need to do for treatment.
Got it. Excellent. Thank you for that, Dr. Anthony. The next one is older cats with feline with all full mouth extraction and FIV plus positive, still getting flare-ups, pain management or anti-inflammatory with drugs from the vet. What's the solution there? What should they do? And this is a bit of a recurring question that we've been getting a lot. You've done all this, it's an older cat, drugs, anti-inflammatory drugs, what should we do and consider for this cat or those cats, older cats?
Well, with flare-ups, again, it can be from stress, it can be from nutrition, it can be from basically lack of home care and constant treatment. As I mentioned at the very beginning, this disease syndrome is not curable, not at this point in time, but it's controllable. And as a result, there's going to be long-term home care that is going to be required. If the owner gets lax on that, or doesn't do a diligent job on it, you have to expect a flare-up. Or if there's a stressful situation, you might have to expect that you're going to have a little bit of a flare-up. Usually it's very easy to get control of it just with those home care products that I mentioned. However, basically, if it gets away on you, you need to talk to your veterinarian.
Excellent. Thank you for that. This is also a very common question that we've seen a couple of times. So what causes the brown, smelly discharge? So the cat has had full mouth extraction already and has been on many different courses of antibiotics, and the brown, smelly discharge keeps returning. So A, what is it? And two, based on what we just described, what should they be considering doing and talking to the veterinarian about?
Well, that brown, smelly discharge could be one of three things. One, it could be blood that the cells have broken apart, and what we call the hemosiderin in the cell, in the red blood cells that causes the redness, can then be caked onto the areas of the skin and hair and causing a brown color. And sometimes it'll be on the teeth as well. And along with plaque that's there will give that basically bad smell. Plaque is basically bacteria, and bacteria produce a lot of sulfur byproducts, and that's what gives that smell. In these animals, a lot of times the saliva is not being produced as much as it should be, and as a result becomes more tenacious or thickened, and as a result it's more mucoid, and as a result sticks to the lips and the hair, and with debris. And saliva has also an enzyme in it called amylase, which will discolor the hair to a brownish color. So that's where the brownish color can come from as well. So it's usually from bacteria, the smell, but and with antibiotics, I mentioned earlier, it depends on what type of antibiotic and what type of bacteria are there. So not all antibiotics are created equal. But I'd rather say that the home care products are far more effective than antibiotics.
Got it. So definitely consider a proper home care solution that you're able to do as a pet owner, as a cat owner, and also work with your veterinarian on the other steps like you mentioned. Excellent. We have a next question that was submitted to us as well. Is my cat, this 14-year-old cat, has had full mouth extraction last spring, but still has lots of congestion and sneezing. Appears that stomatitis is okay, but I feel the congestion is related to stomatitis somehow. What can be done? And is there a correlation with sneezing and congestion, or are we talking about something different?
Well, initially when it first happened, maybe Calici virus was a major component, or herpes virus or something like that, a respiratory virus, and also resulted in a stomatitis that was basically treated and being successful at. However, the respiratory aspect could have continued, and then we have now a chronic respiratory sinus infection. We could have basically necrosis of some of the turbinates inside the sinuses, and there may be even funguses that are. So it's important to do basically some x-rays. Second of all, it's maybe You need to do a cultured sensitivity to see what's growing in there. So the right type of medication can be given to get rid of it. And also it has to be given for a while, because when the sinuses are infected, if it is infected, treatment, some kinds can take up to a month and a half of antibiotic treatment, for example. It doesn't just get away in a week's time or one injection. So sometimes it takes time for basically the antibiotic to penetrate into that area and do its work.
Got it. Any consideration for any biopsy just in case in that? Or what stage would you consider that?
Well, depending on what I saw on X-ray would determine whether I should do biopsies or not. If we take basically a flush of the sinuses, you might want to, you'll see signs of different types of cells and get an idea of what's going there. But an X-ray will tell you exactly basically if it looks like a tumor or not. And then if it did, I would say a biopsy would be warranted, yes.
Excellent. Thank you for that, Dr. Anthony. This is also a question a lot of people are really wondering about, and it's all about laser and therapy. So the first question is, does it work? And if so, there's different types of lasers. If you could help us understanding that, what type of protocol would you recommend with laser therapy if you consider it work from your clinical experience?
Well, there's a few different types of lasers. That's the first thing. And basically, they're not used for the same purposes. And veterinarians have used them for different purposes. Mm-hmm. For example, for the average person, I would recommend you think of it as cold lasers or hot lasers. So either hot or cold.
Right.
Okay, they're called class 1 or class 4 lasers. Class 1 is hot, class 4 is cold. Class 1 lasers basically are very tissue destructive. And some veterinarians have used this to, in essence, cauterize the mouth. What it does is it's basically burning the tissues, burning the bacteria off the mouth. Mm. But then when the animal heals, you have lots of scar tissue. And that's a weakened tissue. It doesn't have as much give as, let's say, the normal mucosa that's there. And as a result, fissures can develop much easier. Oh. So I feel that, in my experience, that has not been the right way to go about treatment for me. Cold lasers, not all cold lasers are made the same. Mm. Some can penetrate tissues very well, but most of them only superficially. So that means with any cold laser, if they don't penetrate the tissues, you're going to have the mouth open for the laser to work. So you have the probe and have the mouth wide open and have the probe there and hold it there for about 10 minutes.
That's not going to happen.
Well, it would be a very, very, very good cat to do that. However, there are some cold lasers that you can just put it out the side underneath here and it will penetrate in very well. So it depends on which laser it is. For me to go through all the different types of lasers that are out there, that's a whole day talk in itself. So I'm not prepared to say which ones are good, which ones are not for these types of purposes, but there's a number of them out there.
So laser therapy can work if it's a cold laser, if I understand correctly, Dr. Anthony, and the key thing is getting a quality one that actually penetrates.
Yes.
Your clinical experience from a hot laser or class 1 laser, not really advisable based on A, painful, and 2, creating some of the scar tissue, which that makes it hard to work with.
Initially, after the hot laser, it looks good. However, it comes back, and usually it's even worse, in my opinion.
Okay, that's very, very good to know. Thank you for that. The next question that we have here that was sent to us was, after 3 dental surgeries and a complete full mouth extraction, she still has a sore mouth. And I was told that she will be on pen medication for her life and potentially impacting liver and kidneys. You've addressed this in some of the prior questions. Is there anything else that you would want to add there so that we can obviously prevent some of the liver and kidney problems long term?
Well, the big thing is you should never have the animal on medications for life if you can avoid it. Off and on once in a while, okay. Now, when I say medication, I'm not talking about home care products. For example, chlorhexidine, which is a home care, it's like toothpaste in a sense. So it's very inert. And, basically, these products that I've recommended are very safe products with virtually no side effects. And pain medications, depending on which pain medication it is, some have significant side effects, others have minimal side effects. So it depends on which one it is. And even then, I wouldn't want to have them on it for life, only when needed. So in other words, if there's a flare-up, put it on for a few days, take it off afterwards. So that type of thing. That's how I would approach that.
Got it. That makes sense. Thank you, Dr. Anthony, for this. We have a question. I think, Roma, that must be you from the Philippines that was sent ahead of time, and I think you had it here as well. Is my cat has increased water intake after the teeth extracted and also a dental prophylaxis. Blood work is normal. What would that be? And as a question that Romer actually does use 1-TDC, can that cause an increase in water intake for the cat?
Well, 1-TDC doesn't increase water intake. So that's the first simple answer. As far as basically kidney disease or that after a dental procedure, if there was damage to the kidneys during the procedure, obviously, yes, there could be. Now, these days, by checking the blood pressure of the animal during surgery, and doing pre-anesthetic workups to make sure the liver and kidney function are good, blood pressures are good, those types of things, and intravenous fluids are given before and after, depending on the situation of the cat. It's rare that would even happen, okay? But can it work? Can it happen? Yes. Now, did the blood work that was taken on this cat, was it, involving the kidney enzymes that will tell us that there is kidney disease? Some people will just check the white blood cells and see if there's any infection, and that's it. Some people just look at the liver. So as a result, were kidneys evaluated? If it was and they were normal, well, afterwards, I would do another blood test to make sure that the kidneys are not affected. And what could have happened is that this animal could have had normal kidneys or normal blood values, but the kidneys were damaged, but were compensating. And then the procedure just put the animal just a little bit over where now it's not compensating as much with the kidneys. So it's got early kidney disease. That may be, something that's going on as well. That's where blood tests are really warranted.
Excellent. And in relation also, Dr. Anthony, from, so the kidney aspect is one of them, but the concern is there's an appearance, or it seems like the cat is drinking more. What about the adjustment of losing teeth and rehabilitating the cat's own ability to drink? Is any impact there?
Well, what could happen is sometimes the cat is not drinking more. It's just that it's spilling water everywhere because it doesn't have the teeth there to keep the tongue proper. It's in the middle, and as a result, it's getting water all over the oral cavity and spilling it all over. So if that's happening, then that's more of a learning situation where with time, the cat will learn how to drink properly without the teeth. But initially, it will be a little bit sloppy.
Understood. Seems like this disease requires a tremendous amount of patience from the cat owner.
It does. And it needs, basically this disease really taxes the owner's sense of commitment to their pet.
And many of you folks I've seen in some of the Facebook groups, actually, I've been so dedicated in sharing and sharing best practices. It's really heartwarming to see. If you've just joined us, we are with Dr. James Anthony. He is a boarded veterinary dentist, many years of experience, thousands of cats he has seen with feline stomatitis. We really appreciate you sharing those Q&A with us, Dr. Anthony. If you've joined just now as well, don't forget, you'll get if you've missed the beginning, don't worry, there's a complete transcript of this that will be provided to all of you who are watching right now. Just go into the chat's location, just put the word stomatitis, and you'll be guided so you can have access to that when it is available. And also, we will be giving some of the folks randomly some of the 1 TDC product that Dr. Anthony has mentioned to help promoting healthy inflammatory responses. And if you have some questions as you're watching right now, if you just joined, do not hesitate to put in the chat. We're doing our best to capture them so that Dr. Anthony can answer those for you. We have one of our last questions actually that was submitted prior. I am a foster with a cat rescue, and one of the 4 cats has stomatitis. Can the pain from the condition of that cat that they're experiencing can create them to be more aggressive at times? In the depth of that question, there was more to it. Sometimes the cat's totally fine, and sometimes the cat is just really aggressive. Could that be related to stomatitis?
In a roundabout way, yes. Let me explain. If you're sick and really, just down in the dumps and everything and sore and whatnot, you don't want people harassing you. Mm. You'll tell them to leave. Mm. This condition, the cats are really not happy. They want to be left alone. And as a result, they can be very aggressive. And if it's just once in a while, it's probably more behavioral, where basically it has good days and bad days. Mm-hmm. But if it's always aggressive, then it's probably something else that's going on as well.
Okay, excellent. So I'm in pain, leave me alone. But if there's a recurring pattern, there could be something else going on.
Well, unfortunately, as a custodian for these pets, sometimes you have to, force the issue, get some of the medications in. Like I said, if this, put it on the ear or other areas, depending on what type of medication it is, that's always an alternative, or mix it in with food, that type of thing. So basically, as a custodian, you have to sometimes push the limits a little bit. Be careful, because obviously that cats can be, they can cause some hurt to you as well.
That's very true. That's very true. If you've just joined us, we're with Dr. James Anthony. He is a boarded veterinary dentist. He's graciously doing a wonderful Q&A for us around feline stomatitis. If you just joined, just make sure you get the transcript of what you missed. Put the word stomatitis into the chat room, and you'll get access to that. If you've got some burning questions, go ahead and put it into the chat room, and we'll do our best to answer it. We have one, which is a really important one from Heather, and I'll put on the screen as well. Knowing that good nutrition is important. What kind of diet do you recommend? Are there any, and I know it's a little hard to give any specific name depending on what countries you're in and so forth, but is there any particular brands that you have used or that you would recommend clinically, Dr. Anthony?
Well, the big thing is you should always look at, as far as diets, you should look at the research of these companies. Basically, if they've got good research, then I would feel confident. Now, there's a number of different companies that are really good companies that do great research, and their diets are good. The best diet you can ever give is the one you make yourself. However, to do it properly is very difficult. Most people would give up after a month because it's very difficult. So the best is if you made it yourself. But again, I'm not talking about raw food diets or anything like that. I'm talking about basically vegetable-based diets with some meat. Remember, cats are true carnivores. They do require meats. They do require some of the amino acids that are in meats, not just in vegetables. You can't have a vegetarian cat. At least won't for very long. Second thing is the commercial products that are out there. There's a number that are very good. I'll just name a few: Hills, even the top line Purina, Medi-Cal, Royal Canine. So these are all good diets. There's many more. And the big thing with this condition is that you need to make the food softer. So it can be the dry food, but you need to water it down, puree it. So it's easier for the animal to eat it and not as painful. It doesn't want to chew, because if you have a toothache and you have basically something really crunchy that you want to eat, like peanuts or something like that, that hurts. You're not going to do that. Same thing with these animals.
Excellent. So there are some good diets out there. Do your research. Even if you have a veterinary nutritionist, always advise the expert that just zero into that. And ideally, maybe some of you folks are experts in creating your own food recipes. Perhaps in some of the groups, there may be some answers that you can do there. Dr. Anthony, you've answered a lot of questions for us. I think we're kind of timed out on questions in your time. We were very, very thankful for all of the information that you provided. If you just happen to join right now, we're just timing out very shortly, but don't hesitate to put the word stomatitis in the chat section. You'll get access to the full transcript. Of course, it's free. We even have some of the 1 TDC, which Dr. Anthony mentioned as one of his protocols for home care as well. And I'm sure there may be more questions down the road, Dr. Anthony, if we can perhaps have you talk about this in the future, or even be more specific about some of those conditions that's hurting the oral health of the cats. And I know you work on dogs as well. We'll be very happy to be able to provide that to our audience. Dr. Anthony, thank you so very much for your time. And thanks everyone for participating and sending your questions ahead of time. Thank you, Dr. Anthony.
You're very welcome. My pleasure.
We will see you soon.
Do it again.
Thank you, sir. We appreciate it. Thanks, everyone. Have a wonderful time. Take care.